Hello and welcome to my YouTube channel, Homeopathic Understanding Simplified. Today we are gonna learn about the comparison between Dulcamara and Natrum Sulphuricum in respiratory complaints. The commonality between Dulcamara and Natrum Sulphuricum in respiratory complaints is that both the drugs have the worsening of symptoms in damp weather. Profuse mucus, asthma, and cough will be present. And core respiratory affinity of Dulcamara is towards mucous membranes of bronchi and larynx, which are driven by a catarrhal rheumatic tendency. Whereas, in case of Natrum Sulphuricum, lower lobe of left lung and bronchi are involved, driven by a hydrogenoid constitution. Coming to congestion and environmental triggers, the weather mainly affects the Dulcamara, which is triggered by a sudden change of temperature. Hot days followed by cold nights, that is the autumnal cold, and getting chilled while sweating is the cause of respiratory symptoms in Dulcamara. Whereas triggered by constant pervasive dampness and living in damp houses or basements and sensitive to water in any form is the causative modality of Natrum Sulphuricum. Coming to asthma and dyspnea, whereas in Dulcamara there is a spasmodic asthma with dyspnea and loose rattling cough will be present brought on by cold or wet weather. In case of Natrum Sulphuricum, there is a humid asthma, hay asthma, and specifically psychotic asthma in children. Coming to breathing sensation, there is a oppression from mucus. The patient cannot bear anything near the mouth in case of Dulcamara, whereas there is a constant desire to take a deep long breath. The chest feels empty or all gone in case of Natrum Sulphuricum. Coming to the cough and the mechanism and timing of the cough, there is a hoarse spasmodic barking or panting cough resembling woofing cough in case of Dulcamara and must cough a long time to expel phlegm. Whereas in case of Natrum Sulphuricum, there is a loose, violent with profound rattling of mucus in the chest. And coming to the timing, in Dulcamara, cough is worse by lying down, worse in winter, and aggravated by keeping warm in a room. Whereas in case of Natrum Sulphuricum, there is a respiratory distress and cough peak especially at 4 to 5 am. And physical concomitant during cough are, in case of Dulcamara, the patient wants to bend forward and cough till the phlegm comes out. Whereas in case of Natrum Sulph, patient wants to hold his chest. In case of mechanical response to coughing, there is a painful constriction of the lower chest which stitches in the sides during the cough in the case of Dulcamara, whereas in case of Natrum Sulph, springs up in bed because the cough hurts so much, must hold the chest with both hands for physical support. And coming to the sputum and discharges, there is a copious, easy, tasteless mucus and often streaked with bright red blood, thick and yellow in case of Dulcamara, whereas thick, ropey, greenish, pus-like, glary, slimy sputum in case of Natrum Sulphuricum. And the sensation during respiratory complaints, in case of Dulcamara, there is a deep cutting pain in the left side just below the clavicle, sensation in the left chest as if the lung moved in waves. Whereas in Natrum Sulphuricum, there is a piercing pain and stitches in the left side of the chest, pain strictly localized about the 9th or 10th rib on the left side. And coming to the general modalities, the aggravation in case of Dulcamara is at night, rest, cold air, and the suppression of normal discharges or sweat. and amelioration by moving about and application of external warmth. Whereas in case of Natrum Sulphuricum, aggravation by lying on the left side, late evening, wind and the pressure of tight clothing, and amelioration by dry weather, changing position frequently and open air. At last, there is general comparison between Dulcamara and Natrum Sulphuricum is that in constitutional diathesis, Dulcamara is phlegmatic, scrofulous, torpid, and pathology arises fundamentally from suppressed sweat or eruptions. The quintessential autumnal remedy is the Dulcamara. In case of Natrum Sulphuricum, it is arised from Hydrogenoid Constitution, psychotic gouty diathesis, and pathology arises from extreme cellular water retention, the quintessential basement or spring remedy. And coming to mental state and digestion, Dulcamara has the mental confusion, rejects things asked for, aversion to food with a burning thirst for cold drinks, whereas Natrum Sulphuricum, melancholy specifically worsened by music, deep liver involvement, bitter taste, and a dirty greenish brown coated tongue will be present. Thank you.